Hi everyone. In this video, I will be going over person-centered therapy. This form of therapy is also called client-centered therapy or called Rogerian therapy based off of its originator, just in case you were wondering. All right, so in Roger's view, people have a vast potential for understanding themselves and resolving their own problems without direct intervention from a therapist. People are essentially good and ultimately know what is right for them. Further, people are capable of self-directed growth if they're involved in a specific kind of therapeutic relationship. Accordingly, the therapist's attitudes and personal characteristics, as well as the therapeutic relationship, are the primary determinants of the outcome of therapy, meaning they're the most important. In order for a therapist to be effective, they need to be warm, genuine, and understanding, and there will be specific characteristics of a therapist, an effective therapist, given a little bit later in these slides. This form of therapy rejects the deterministic nature of psychoanalysis and behaviorism. It maintained that we behave as we do because of the way that we perceive our situation. So clients would be better helped if they focus on their own subjective understanding instead of trying to figure out some unconscious motive or someone else's interpretation of the situation and why it's maintained. Since no one else knows how the client perceives but them, they are the experts of themselves. Therefore, the focus of therapy is the client's subjective experience, and we view them as the experts of their experience. Theories and techniques are secondary in this approach. One of the basic assumptions is that clients can make their own decisions if they are in environments that foster growth. So we focus on their strengths and not their weaknesses. Rogerian therapists also believe that people are innately striving toward becoming fully functioning, which is called self-actualizing or the actualizing tendency. Rather than viewing people as inherently flawed and needing treatment, this approach views people as inherently having the motivation to move toward growth, meaning, and purpose. Their self-healing, their self-directed, their self-actualizing capacities are activated as they become more empowered and feel more capable. Because clients are the experts in their own lives, they have the capacity for resolving life's problems effectively without needing interpretation or direction from a so-called expert therapist. Therefore, your job as a therapist is to understand the client's subjective world, and that will allow you to understand their behavior. Let's look at some key concepts. As I mentioned, there are some characteristics of an effective therapist according to person-centered therapy. Rogers believed that for a therapist to be effective, they must possess the following three characteristics: congruency, unconditional positive regard, and accurate empathic understanding. I will go into more depth on each of these next. First is congruence, which can also be thought of as being genuine. This basically means being a real person and being genuine and authentic with clients, as opposed to being a blank slate. Rogerian therapists would believe that it's not possible to be a blank slate. You cannot feel a certain way and act a different way. This incongruence would be obvious to the client and detrimental to therapy. So therapists must be authentic. And by being authentic, therapists act as models for clients so they can see what it looks like to be real and accepting of oneself. This also means that it would be appropriate in therapy for the therapist to express certain emotions and thoughts that they're experiencing to the client, so long as they are in the best interest of the client. Unconditional positive regard is perhaps one of the most commonly known concepts from person-centered therapy and is used in lots of different forms of therapy. It essentially means being fully accepting of our clients, their beliefs, and their feelings. It's a deep and genuine caring for the client. Note that this doesn't mean that you have to approve of everything that the client does. Instead, it means that you're accepting them as they are. Some things to consider here if you're going to take this approach, a person-centered approach, is which prejudices and assumptions might you have as the therapist that could make it difficult for you to accept certain clients. Also, would you put certain conditions on your acceptance of people? And what happens in therapy if your client doesn't meet those conditions? The third characteristic of an effective therapist is accurate empathic understanding, which has also been called deep subjective understanding. Basically, it means that a therapist will be empathic or empathetic without becoming lost in the client's feelings or feeling sorry for them. It isn't about feeling pity for them, it's about feeling with them. Empathy like this helps a client in a lot of ways. First, it helps them to feel validated in their experience and in their perception of that experience. It also helps them to become less defensive because they believe that you care about them. It can help clients to become more open to seeing their experiences in new ways, and it can increase their confidence in making their own choices and following through with them. But an important question to ask here is, what exactly is empathy and what does it look like? How can we define it? Nicola Davies offers a useful example. She says, imagine being at the bottom of a deep, dark hole. Peer up to the top of the hole and you might see some of your friends and family waiting for you, offering words of support and encouragement. This is sympathy. They want to help you out of the pit you found yourself in. This can assist, but not as much as the person who's standing beside you, the person who is in that hole with you and can see the world from your perspective. This is empathy. Brené Brown also has a nice video that illustrates this concept, and I'm going to share that with you next.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, so the next key concept is self-concept. And this idea is defined by simplypsychology.org as the organized, consistent set of perceptions and beliefs about oneself that consists of all the ideas and values that characterize I and me, and who I am and what I do. Our self-concept influences how we perceive the world and ourselves. A client who perceives themselves as incompetent would behave meekly and be hesitant to pursue certain opportunities, for example. However, someone's self-concept may not fit with reality. The way we see ourselves may differ drastically from how others see us. This difference, however, does not mean that our subjective perception is less valid or real for us. Remember that the client is the expert of their experience, and the way that they perceive it is reality for them. Okay, so now let's move into the therapeutic process according to person-centered therapy. We'll begin with assessment. And as in some of the other approaches we've looked at, there is no formal assessment process in this approach because it doesn't matter much how the therapist assesses the client. Remember, the therapist is not the expert in this case. What matters is how the client assesses themselves. So the therapist should create a climate that's conducive to self-exploration for the client, where the client can explore their own experiences, feelings, behaviors, and beliefs. Strategies to help the client with self-exploration might be having the client free associate, in which we encourage them to say whatever comes to mind, or by doing some kind of expressive arts, which we'll talk about later. Then the client consciously and rationally decides for themselves what is wrong and what should be done about it. Rogerian therapists suggest that maladaptive problems, behaviors, and patterns arise from incongruence. Specifically, people experience dysfunction when there are inconsistencies between their self-perception and their experience in reality. Cognitive dissonance would be a related term, and that comes from social psychology. An example from your textbook is helpful. So Leon, a college student, may see himself as a future physician, yet his below average grades, the reality, could exclude him from medical school. This discrepancy between how Leon sees himself, his self-concept, or how he would like to view himself, which would be called his ideal self-concept, and the reality of his poor academic performance result in anxiety and personal vulnerability, which may bring him to therapy. Leon then must perceive that a problem exists, the difference, he needs to perceive the difference, the incongruency, in order to be able to explore possibilities for change in therapy. So, since the therapist is responsible for improving their life, not the therapist is then there to listen and to encourage at an equal level with the client. That means that the therapist is non-directive, so there's no advice giving or planning interventions for sessions, none of that. It's not about the therapist's knowledge or techniques. It's their attitude and the quality of the relationship that they've developed with the client. So remember the characteristics that we went over at the beginning. A therapist needs to be genuine, integrated, authentic, and show unconditional positive regard and empathy. In this way, they facilitate a client's self-discovery by being caring and empathic. Then the client can become less defensive and more open to change and experience. Because of this, it's really the relationship between the client and the therapist that becomes the instrument of change, and it's your job as the therapist to make that relationship happen. Goals of therapy. Before we discuss specific goals, it's important to remember a few things about person-centered approaches as they relate to goals. First, remember that Rogers believes that people are moving towards self-actualization on their own when there's openness to experience, trust in themselves, an internal sense of motivation, and a willingness to continue growing. Accordingly, the focus of therapy becomes helping the client to become more fully functioning and move toward that self-actualization. We do this by creating a climate of safety and trust so that the client can explore themselves and become aware of personal blocks to growth, as well as become aware of personal strengths. With this in mind, some important general goals in person-centered therapy are developing congruence between the self-concept or ideal self-concept and reality, increasing self-esteem, increasing openness to experience, and reducing defensiveness, guilt, and insecurity. Remember, however, that specific goals should be created by the client who knows what the goals should be for themselves. To sum things up a bit, the phases of therapy look like this. First, the client expresses their feelings, thoughts, and beliefs, which can be thought of as the assessment, and the therapist listens. Then the therapist reflects the client's problem and situation to make sure that they understood and to help the client feel validated. The problem is then clarified collaboratively. What exactly is the problem? Why is it a problem? And so on. And the client then decides what to change. There are no specific techniques in this process, but there are some things to keep in mind that may be helpful, and I'll discuss them next. First is active listening. In this approach, active listening is demonstrated through the reflection of a client's feelings and thoughts. During therapy, you should check in with yourself to make sure that you're not dominating the conversation, giving advice, or trying to solve the client's problem. That's not your job. Instead, you should act as a sounding board. as a sounding board by reflecting the client's ideas in your own words and showing them that you're listening. You also need to remain non-judgmental. Clients already have feelings of inadequacy and guilt, so make it clear that you won't reject them. Paraphrasing is especially helpful with active listening. Paraphrasing involves repeating what the client has said without adding in your own interpretation. This helps show the client that you were listening and also helps the client clarify their feelings if they felt misunderstood. You also want to make sure that you're not making decisions for the client. This is not helpful. We often go to giving advice because we're feeling helpless in what we're hearing, or we're uncomfortable with someone's discomfort. Don't do this. Become comfortable with negative emotions and emotional states, and don't take them personally. It's not about you. How you speak also matters, so pay attention to your tone. Do you have a judgmental tone? Do you have a non-accepting tone? Or are you expressing through your verbal and nonverbals that you are here to listen, here to help, and supportive and accepting? Open questions are also helpful, specifically questions like, how does that make you feel? Which can help the client to deepen their self-exploration. Encouragers, which are words or phrases that encourage a client to continue sharing or elaborate further, are also helpful. So when your client is speaking, saying things like, okay, tell me more, or what else? Or even nodding your head and saying, go on, shows the client that you're engaged and interested and encourages them to continue speaking. Expressive art can also be helpful in this process and can provide healing and further exploration. It can be used in person-centered therapy simply by asking the client to draw what they want to draw, kind of like a free association. You can also do more directed activities like free association paintings, collages, movement arts, and things like that. The creation of this art can help the client to both express what they're experiencing and also to work through it in their own way. So now we'll evaluate. First, the strengths. Allowing the client to decide what they want to work on and how to work on it is clearly aligned with our ethical code of autonomy that shows that the client gets to decide what therapy looks like for them. The value that's placed on empathy is extremely helpful and may be the first time that the client is feeling like someone really feels with them. The values and principles of the approach, such as the emphasis on the therapeutic alliance, can be incorporated into lots of different approaches, which is why you may have heard of unconditional positive regard, for example, before ever hearing about this particular approach. Finally, it doesn't require that the therapist act like someone else. You get to be genuine and real and express and create a real relationship with boundaries. Limitations, it doesn't provide a lot of structure or clear interventions. You'll notice that in other therapy videos, I've given you specific interventions or strategies. There really aren't any here because the focus is on the relationship. Also, as I've mentioned in other videos, clients who prefer a more directive approach might not really benefit from this particular approach to therapy or might think of the therapist as not capable of helping them. Finally, it may be a bit challenging to use with certain insurance companies or contracts since the goals are client developed and may not be aligned with billing requirements. So that's also something to keep in mind. This doesn't mean that you can't use it if you're billing insurance. It just may require that you tweak the goals a little bit in the treatment plan. Okay, so that is it for person-centered therapy, also called client-centered therapy. Let me know if you've got any questions or you need clarification on anything. All right, thanks.